Good afternoon, everyone. To the left and my right is my amazing audience. Thank you. And now we can begin. Hi, everyone. My name is Hannah Cole, and I'm a survivor of peripartum cardiomyopathy. Now, never in my wildest dreams did I think that at the end of my pregnancy, I would be told that I was in heart failure. Today, we're going to talk about what is peripartum cardiomyopathy, some of its signs and symptoms, treatment options, and how more oftentimes than not, this disease goes misdiagnosed. So, Dr. James Fett and his team from the Investigative Cardiomyopathy Association of Peripartum have been working over the last 10 years on prevention methods and ways to properly diagnose this disease. First, though, let's take a look into what exactly is peripartum cardiomyopathy. It is a rare form of heart failure that is developed in the late stages of pregnancy and up to 5 months postpartum. It is the left ventricular diastolic dysfunction of the heart, basically meaning that the left side of your heart has become enlarged and your body can no longer pump enough blood to circulate throughout the rest of it. Now, although there is little known about this disease, there does seem to be a direct link between the blood volume increase while you're pregnant. Now, while you're pregnant, your body is producing 50% times more blood in order to keep up with the oxygen and nutrient needs of your growing baby. Now, Dr. James Fett wrote in the Lancet Journal in 2009 that although we do not know the cause of this disease, we do know that certain people are at a greater risk of developing it. That would include women over the age of 30, anyone carrying multiples, women with a history of preeclampsia and eclampsia, and women of African descent. So now that we've talked about what is peripartum cardiomyopathy, let's go over some of its signs and symptoms. Signs and symptoms could include swelling, edema, more commonly known as swelling, shortness of breath, an unexplained cough, frequent nighttime urination, and excessive weight gain of more than 2 pounds per week. Now, I'm sure at this point you're noticing that there is a little bit of similarities between pregnancy symptoms and cardiomyopathy, but we will get into that later. First, let's take a look at what are your treatment options. So your treatment is going to depend on what your ejection fraction is. And your ejection fraction is going to be found through an echocardiogram, which is a picture of your heart. Now, ejection fraction is the percentage of blood that pumps through your body. So your doctor is going to get that ejection fraction, and a normal ejection fraction is between 55 and 70%. According to the American Heart Association, when your ejection fraction is between 30% and 50%, the proper diagnosis and medications is going to be ACE inhibitors, diuretics, and beta blockers. Now, when your ejection fraction drops below 30%, along with that medication regime, you would also need to probably get a pacemaker, a life vest, or a ventricular assist device, which would essentially shock your heart back into rhythm should it stop. Now, for some women, recovery is not achieved and they will need a heart transplant. So we've talked about our treatment options, we've talked about our signs and symptoms, but let's look at the big question: why is this disease misdiagnosed? And the answer is simple. Late stage pregnancy symptoms and peripartum cardiomyopathy mimic each other. Your doctor is going to tell you to expect swelling, expect fatigue, shortness of breath. And so when you're complaining of these symptoms, the link is not made. You combine that with the fact that this disease is uncommon and most OBGYNs are not up to speed on its current dynamics, it's the perfect storm for a patient not being properly diagnosed. So today, we've talked about what is peripartum cardiomyopathy, and that's that left ventricular diastolic dysfunction. Its signs and symptoms such as swelling, shortness of breath, and fatigue. Treatment options such as a life vest, a pacemaker, ACE inhibitors, beta blockers, and then we talked about why it is more commonly misdiagnosed. Thank you all for giving me the time to raise awareness in peripartum cardiomyopathy, and I look forward to working with each and every one of you in the future of coming up from prevention methods and possibly saving a mother's life. Have a great day.